Hello everyone, my name is Dr. Ridhima Bhagli. I am director at Medilaser and I am a practicing cataract and refractive surgeon at Medilaser in Pune. Today I am going to discuss a very common disorder of the eyes, and that is dry eyes. Why am I saying it's very common? Because in the normal population, 1 out of every 3 persons suffers from dry eye. So what is dry eye? It's a group of disorders in which the tear film of your eye is affected. Either your eyes are not producing enough tears, or the quality of the tears that is produced is not good enough. So let's talk about the tear film of the eye a little bit before we dive into dry eye. The tear film of the eye is extremely important for your eye to feel comfortable and for your eye to remain healthy. The tear film is made up of 3 layers. The outermost layer is an oily layer, and that is secreted from oil glands in your eyelid. The middle layer is an aqueous layer or a watery layer that washes out all the foreign material and debris that may get collected on your eye, and this watery layer is produced from the lacrimal or the tear secreting glands. And the innermost layer of the tear film is a mucus layer that is produced by cells of the conjunctiva. So if any of these 3 layers is deficient or the production is impaired because of variety of causes, then the quality of your tear film or the thickness of the tear film may fall inadequate and you may suffer from dry eye. Coming to the common causes of dry eye. Causes, I think the older population will suffer from dry eye much more than the younger population, and that is primarily because of hormonal changes that happen in your body. Hence, females are more prone to dry eye, especially at the time of menopause as compared to their male counterparts. Other common causes of dry eye can be some systemic conditions, like if the patient is suffering from an autoimmune disease like arthritis, then the patient is more prone for dryness in the eyes. Any local diseases also, like a lid infection like blepharitis, can cause dry eye. Also, our lifestyle plays a very important role. A lot of the young population is spending their entire job or working hours in front of a computer screen or a laptop or a phone or a tab in their hands, and then constant gadget use limits the amount of blinking that your eye does, and this can also add to dryness. If you're working in a dusty, windy, smoky environment, this can also cause dryness in your eyes. Also, a lot of people take a lot of medications like pills for hypertension or antidepressants. These may also cause dry eye. We've seen a lot of causes that can cause dry eye. Hence, it is commonly called a multifactorial disease or dry eye syndrome, because dry eye may be associated with other diseases in your body. Coming to the symptoms, how do you know that you have dry eye? The symptoms are quite common. Everybody once in a way may experience these, and they could range from simple burning or stinging in the eyes to foreign body sensation. You may feel that something is in the eye, or reciprocate. It can present like watering from the eyes. Yes, a lot of patients, if you ask them, are your eyes dry, they say no, mine water a lot. But watering is the response of your body to dryness. So continuous watering, especially on exposure to sunlight, exposure to wind, on reading, watching the television, reading the newspaper, using your phone, if your eyes water, that could be a sign that you may be suffering from dryness in your eyes. So how do you diagnose dry eye? I think the first and important thing is to get your eyes examined regularly with your ophthalmologist. A routine eye examination, an examination of the eyelids and the tear film can give an indicator whether you have dryness or not. There are a few simple tests that can be done by your ophthalmologist to see the quality, the thickness of your tear film, how you blink, whether your blinking is sufficient, and also how much tears you're producing. They're simple strips that are placed in your eye, and the amount of wetting of the strips can measure how much tears your body is producing. So do go and get your tests done if you think you may be suffering from dryness. So what are the complications of dry eye? Usually mild to moderate dry eye doesn't have any other complications other than just the discomfort that it will cause you in your day-to-day life. But extremely severe dry eye can sometimes cause complications like your eye is more prone for infections, or your eye may develop opacities and it may affect your vision as well. So occasional blurring, which gets better with blinking of the eyes, can also be a sign of dry eye, and you need to get it tested with your ophthalmologist. What is the treatment of dryness? Usually the first step of treatment is using artificial tears. So these medicines are nothing like, they're just like your natural tears. They just replenish your tear film temporarily. It's like using moisturizing cream on dry skin. So they form a temporary tear film layer over your eyes that would range, it would act for like 2 hours to a few more hours depending on the molecule that we use. But if you think that you need to use artificial tears very frequently, it may be suggested that you use preservative-free eye drops. There can be other modalities of treatment, especially those directed towards the culprit. Like if a mild lid infection is causing dryness, that needs to be treated, or if the oil glands in your eyelid are blocked, then you may be advised to do warm compresses and lid hygiene and massaging your eyelids to help production of the oil layer that can help relieve your symptoms. A common and more important lifestyle change that can help prevent dryness is limiting your screen time. Giving intermittent rest and breaks to your eyes is absolutely necessary. So it's called the 20-20-20 rule, where every 20 minutes you should look away from the screen for at least 20 seconds, more than 20 feet away. That helps relax the muscles in your eyes. It can help your eyes strain. You need to try and blink more frequently. Avoid a direct draft of wind like a hair dryer or the AC directed towards your eyes. Make sure that your gadget is at a level lower than your eyes and perpendicular to the range, perpendicular to your line of vision. Make sure that if there's too much dryness around, it may be necessary to incorporate humidifiers into your environment depending on which part of the world you're living in. Other important modalities to prevent dryness are including a healthy balanced diet. It has been shown by various studies that including omega-3 fatty acids in your food can help reduce the dryness by improving the quality of your tear film. Getting evaluated for any systemic conditions can also help prevent dryness. I hope this little information has helped you. Till next time, thank you very much.